lot of patients I've seen who have gone and had an evaluation by one of the EDS surgeons, as I mentioned, or the CCI surgeons, as I mentioned, the vast majority, they're going to recommend non-operative, non-surgical strategies, at least initially. So they'll say, well, go and do physical therapy and so forth. The problem is, again, they don't necessarily have a person say, okay, we'll go back to Illinois, go back to, Ohio, wherever you're from, and, work on this and see if PT will help. But, unless there's a specific person, that may not go well. There was some questions about wearing cervical collars to help. A lot of people, many people with CCI feel that their head feels too heavy for their neck. They get fatigued, they get tired. We definitely don't want people wearing collars all the time, hours or even hours out of the day, because we do get concerned that muscles can become weaker and atrophic. But it can be valuable to wear for short periods. Certainly it can be helpful if you're riding in a car and your head's getting jostled. So we generally say you can wear the collar up to 2 hours, and then we want you to be out of the collar for a comparable amount of time, so at least 2 hours out of it before you put it on. Again, the hope is with some other treatment we can at least have a better solution than the collar. Sometimes we'll use the collar, and when I speak of collar, I'm not talking about those little foam squishy things. Those are usually not enough support. Some sort of plastic hard collar. There's different kinds, and two brands that seem to work for the most people are something called the Aspen Vista, A-S-P-E-N, Aspen Vista collar, or the Miami, like the city, Miami J as in Juliet, Miami J collar. And some people do better with one than the other. They're shaped somewhat differently. You can order any or all of these sort of online by yourself, but a provider can give you a prescription, and you can go to a so-called brace shop, and somebody can fit you, or they can try different ones on and figure out what model and what size works best for you. And that can be a way to help figure out, does that at least help your symptoms? If it doesn't mean that you don't have CCI, but it makes us suspicious that other things are going on. Sometimes traction can help. So going to a physical therapist, or even getting a device on your own and stretching your head up a little bit, and that can help relieve issues related to CCI. So if somebody has a big response to traction, then that could be grounds for them going the next step to at least considering further interventions for CCI. If traction doesn't help, then again, we wonder, it doesn't mean it's not CCI, but we wonder about other things. The problem is, neck pain is very common. There can be arthritis and bulging discs, especially in somebody with hypermobility. And that doesn't require CCI, and those problems can be just from those issues. There could be pinched nerves in the neck that cause numbness. There can be dizziness related to POTS, and just some simple treatments towards the POTS can help.